India enters day 11 of the lockdown. At the time of recording, as per the Johns Hopkins University of Medicine, which we here at TIW consider as a good source of information, the total number of COVID positive cases worldwide stands at 1,030,628 with 54,137 deaths. In India, the total number of confirmed cases stands at 2,567 cases, with 72 deaths at the time of reporting. My name is Partha, and you're watching the second episode of Partha Reports. Alright, gang, by now I'm sure all of you have endlessly heard the following phrases: break the chain, social distancing, self quarantining. But what does all this really mean, and does it really help us win the war we fight against the novel coronavirus? Now, before I start, I humbly request all of you to not just like this video, to subscribe to our channel, but please share this video on WhatsApp to all your contacts, because quite literally it can save lives. Now, I also want to make one thing clear: this video is not monetized, our channel is not monetized. You liking the video, subscribing to our channel, and sharing this video to everybody, which I hope you would, is not going to benefit us in any sort of way financially. Now that that's out of the way, in today's show, we're going to talk about 5 reasons why we need to stay at home to win the war against the novel coronavirus. Reason number one: understand how this virus works. So now this virus is now any virus is so tiny that you actually can't see it. But for the sake of explanation, just assume that this object that I'm holding in my hand is the virus, right? Now this thing here, the virus, it has a life, right? Now, first things first, understand this: the virus is all around us, right? It could be on the counter of the medical shop which you visit, right, because somebody touched the counter who was positive. It could be on the road because somebody who was positive spat on the road, right? But what you need to understand is that the virus has a short life outside of the human body, a longer life inside of the human body. It needs a host. Okay, now according to the latest research about COVID-19, the virus can survive on a piece of cardboard for about 24 hours. On a piece of plastic or steel, it can live up to even 3 days. So, does this mean that if we all stay at home for 3 days, that this problem will be solved? Unfortunately, that's not the case. Now, so far, as you all know, that there are over 2,500, 2,600, 2,700 cases which are confirmed of COVID-19 in India. But the real number could be as high as 25,000. In fact, it could be 50,000 or even 100,000. Why is this? The fact of the matter is that India is not conducting large-scale population tests for the virus. We simply don't have millions and millions of test kits to do so. So the actual number of people who are infected but don't even know about the fact that they are infected is huge. And it's possible because according to the latest data, a lot of people do not even show symptoms or show very mild symptoms but are positive. That's what we found out in the recent days. So it's not necessary that that if you're positive, you are showing all the symptoms and you're like coughing and you're breathless. There are people who completely don't show any symptoms or very little symptoms, right? So the number could be a lot higher than what's being officially reported because we simply don't test enough. We can't at this point of time. Now, as I said, that the virus needs a host to live longer and to reproduce, right? So let's assume that you have a friend whose name is Arun, right, who has the virus, but he does not know that he has the virus because he doesn't show much of the symptoms. All right, now two things can happen, right? Hopefully, Arun will beat the virus and live, or God forbid that Arun will die from the virus, right? But the point of the matter is that Arun will have this virus inside of him for up to 4 to 5 weeks. But there are probably thousands and thousands of people like our imaginary friend Arun who have the virus and don't even know that they have it. And if you go outside with them, all right, and you come into contact with people like that, or touch the things that they touched even 2 or 3 days back, you can get the virus too. So this quarantine will require many weeks of all of us being responsible citizens and following it. Reason number two: things can get really bad. Really, really bad. Now, look, I don't mean to be an alarmist here, but things are going to get worse before they get better. See, the problem with us human beings is that we understand numerical progression very easily, right? And we're not so good at understanding exponential progression. So, the human psychology can easily understand, okay, 10 cases becomes 15 cases, 15 cases becomes 20 cases, 20 cases becomes 25 cases. But that is unfortunately not how this works, right? So, what happens is one person is unaware that he is COVID positive, he breaks the quarantine, he goes outside, right? That and that one person infects five other idiots who are roaming around for no good reason. Those five people infect five people each, so the number becomes 25. 25 then becomes 125. 125 then becomes 625. You get the logic. So basically, one person unaware that he has a virus, if he irresponsibly breaks the lockdown and goes out, he could end up probably infecting 1,000 people, and that's very much real. And that's a difference between numerical progression and exponential progression. Now some people actually think and may think that 3,000 cases around roughly at this point in a country of almost 1.3 billion is nothing. But that's what the people of Italy and the United States of America thought initially when the numbers were low. Again, because people don't understand exponential progression. But then all of a sudden, in New York alone, the number of cases started doubling every 2 days. And thousands of people have become infected in a single city in the US, right? The US, which has over 270,000 confirmed cases at the time of recording, has already lost more lives to this pandemic than the lives lost in the terrorist attack of 9/11. Think about that. Reason number three, India is ill equipped to deal with this virus. Now, look, in episode one, I told you about how doctors in Bangalore are wearing raincoats and helmets to go near patients. We are basically running out of basic medical supplies. But let's forget that for a second, all right? How does the coronavirus kill a person? So, basically, what happens is that a person usually gets complications in his lung, like, for example, pneumonia, right? And then the patient begins to struggle. Now, at this stage, to save the patient, we need an equipment called as a ventilator, which I'm sure most of you have heard of. This equipment, the ventilator, helps the patient breathe. Without it, the patient struggles to breathe and in many cases dies. In fact, according to the latest reports from New York, even with a ventilator, 50% of the people who are being intubated are dying. So even with the ventilator, it's quite hard. Now, in India, the number of ventilators and other life-saving equipment is really low when you compare it to the massive size of our population. The government of India is doing all it can to produce the necessary equipment, but this is going to take weeks for it to actually reach all the hospitals in the country. And let's remember that even a superpower like the United States of America is struggling to manufacture these life-saving equipment in the numbers, in the required quantities. Italy, which was actually considered by many as a second best country in terms of healthcare services, is now a mess. A week or so back, the Italian Prime Minister Giuseppe Conte, he appeared in a national address and almost basically just cried in helplessness. India lags far behind these countries in terms of medical infrastructure, and this is why self-quarantining is important. Now, let me illustrate this to you in terms with the help of something which is called as a bell graph or a bell curve. Sorry. Now, I hope you can see this. All right. Now, assume that this blue line here, all right, is the nation's capacity to handle a massive pandemic, like the number of beds we have, the ventilators we have, the number of hospitals we have, the number of doctors we have in terms of ratio with the population. This is our capacity as a country to handle a crazy pandemic, right? Where massive number of people are getting affected. Now, this red line, which you can see here, is the nightmare scenario. This green line, which I hope you can see, is the best case scenario. All right, this is what we call flattening the curve. All right, in the worst case scenario, suppose we do not act responsibly, we do not socially maintain distance, and if we break the quarantine, the virus is going to multiply a lot faster. The number of people who are going to get infected it's going to be a lot faster. So the graph goes up like this. Now, this area, look at this area right there. All right, this is where we get screwed, which basically means that there will be people who will not be able to access a hospital bed, will not be able to get a ventilator, will not be able to get any support because the hospitals are all jam packed. And usually that will be the poor people because they are valued the least in almost every society. So in that case, you can end up having 2 million or even 3 million deaths from this disease. Now, the best case scenario, now, if we actually follow the quarantine, what we can do is we can so we can slow the spread of the virus, all right, and make the curve gradual, right? The increase gradual, and then at some point it flatlines and it decreases. So at this point, the doctors are heroes, the healthcare professionals, our medical infrastructure, which is not great, we are able to handle this load, and hence we can end up saving a lot more people. So I hope this graph helped you in some way, and I hope I was able to explain it to you in a way that is easy. All right, reason number 4. All right, you may not die from it, but you can kill your loved ones by being irresponsible. Now let's look at this. You know what I mean. I mean, like you all have met such people, right? I'm a gym body, I have great immunity, I can go outside and nothing will happen to me. Yeah, you may be right. A lot of people who are infected don't actually die, right? The death rate in the US right now is at 1.5%. In Italy, it's 3.5%. Meaning that on an average, only 1 to 4 people out of 100 who are infected actually end up dying. But think about this, right? Say you act like an idiot, roam around and pick up the virus. You may not die, but in the next 2 weeks, you can give the virus to your parents or to your old grandma. And given their age, they have a huge chance of dying if they get infected, right? Do you really want to be the kind of person who ends up killing his own family and friends out of sheer stupidity? I don't think so. I hope not. Now, reason number 5, and one of the biggest reasons, right? There is no cure. The earliest we would see a vaccine for COVID-19 is probably 6 months away. Companies like Johnson & Johnson have begun clinical trials but have warned that they need many months before they can put a vaccine that is safe to use. There is also no cure as a medicine at this moment, which is a definitive cure, and a definitive cure may take up to 3 months, according to representatives of the pharma industry. Yes, there have been some promising cases where patients have responded well to certain drugs such as hydroxychloroquine and azithromycin and a couple of other drugs, and we do see some positive signs. But it's too soon for us to tell that these drugs will definitely be the solution. It's too soon, right? We need to test more, and we need to be sure about this. Now, look, because there is no definite cure, if you get really sick, doctors may not be able to save you. Remember that. And doctors themselves are dying. And I have to mention this: do not be misled by any information about magical cures for this disease from WhatsApp University, right? We all know what WhatsApp University is. And one last thing, please do not self medicate. Consult your family physician, your family doctor, before you take any medicine. You may have a cold, you may have a cough, you may think it's a coronavirus. Don't listen to something which you see on WhatsApp or online and take a tablet which you're not supposed to be taking, right? People die when they self medicate. It happens. Anyway, it's time for me to say goodbye till we meet again. And please do share this video to every single person you know. You actually may end up saving a life. I really appreciate your time. Thank you. And as always, guys, Jai Hind.